Okay, hello, my name is Rindi Appelman and I am going to be doing a video for the ears, eyes, nose, and throat for Nursing 612 Advanced Health Assessment. Good morning, my name is Rindi. I'm going to be assessing you today. This is Charlisa. She's over 18 and she's agreed to be my participant. So we checked her vitals and triage. Her blood pressure was 105/67, heart rate of 60, respiratory rate of 16, 100% on room air. So those are all good, nothing to be worried about there. We also did a Snellen eye visual acuity test, and she was found to have 20/20 vision in both the right and the left eye. So right now we will do the Rosenbaum, which is this little card. You're going to hold it 14 inches from your face, and I want you to read the smallest line that you can.
STOPTHESIZZLE.
Okay, so that was 20/25, so that's also good. No visual disturbances, doubled vision, blurred vision. You don't wear contact lenses. Great. Okay, so now we're going to do the confrontation test. So I'm going to hold my fingers in front of you. I want you to look straight ahead and tell me when you can no longer see them.
Now.
Great. So that's about normal, to be expected. At this time, I'll start inspecting the orbital area. So I noticed that her eyebrows are intact. They're a normal color. They extend to the canthus, which is good. She has all her eyelashes are present. There's no exudate noted on any of those. The lacrimal gland doesn't have any discharge. Her iris color is a hazel green. The sclera is white with blood vessels noted, which is normal. I'm going to take a look at her conjunctiva, which is a reddish pink color, not pale, not to be expected with any blood loss or anything like that. So I want you to close your eyes. I'm going to look at your eyelid. There's no lesions, no masses noted. You don't have any tenderness in here. Okay, good. So then I don't see any fasciculations, no redness, no swelling, anything like that. We'll look at the pupil size. And so it's about a 2, and so we'll check for the perla. The pupils are equal and responsive to light, reactive. So I'm going to first shine the light into, you're going to look straight ahead, I'm going to shine the light and watch your left pupil, and it constricted, and now I'm going to watch the right eye, and it also constricted, and then the same in the left. I'm going to watch this pupil, it constricts, and now I'm going to look at the left eye while I shine the light in the right eye, and it also constricted. And then we'll do the corneal light reflex. So just look straight ahead, and then I'm going to shine this in the middle and watch for the light reflex. And it is symmetrical in both eyes, so that's a normal finding. At this time, we'll check the 6 visual fields of gaze, and so I want you to follow my finger. We're going to go up and to the left, down, across the body, up and to the right, down, inward, and then follow my finger in. Great, so that was normal as well. And then the last one we'll do is the cover-uncover test. So we're going to watch for any lateral or nasal movement. So go ahead and cover your right eye, and I'm going to watch the right eye when she uncovers. Uncover. Great, no drift noted. And go ahead and cover it again. I'm going to watch the other eye now. Uncover. Great, no nasal or lateral drift noted there. So other eye. I'm going to watch the covered eye when she removes it. Great, no nasal drift, and then cover again. And then now I'm going to watch the right eye when she uncovers. And good, no lateral or medial drift in on that as well. So at this time, we'll go ahead and use the ophthalmoscope and look in the inner eye. I'm going to look at her left eye first. So I'm holding it in my left hand, and just look straight ahead. And this is kind of uncomfortable, so bear with me, okay? So I'm going to go through the lens, and I find the blood vessels. I'm going to look up to the medial, down, medial, up, lateral, down, lateral. And I was able to find the red reflex. The retinal color was a reddish orange. The blood vessels were intact, and the macula was also visible. So now I'll look at this other eye for the same things. And so I'll hold it in my right. And same, up, up, down, down. Great. And so the blood vessels and retina color were all within normal limits there as well. That concludes the eye. We'll move on to the ears and look at the auricles. There's no masses. They're symmetrical, and in a good position to the eyebrows. No tenderness.
No.
Give them a little tug. Nothing back here into your mastoid. Great. And so then we're going to look inside of your ear. So I just need you to let me know if you have any tenderness when I do this, okay? So I'm going to look at the external ear. I see the cilia. I don't see any excessive amount of serum. No swelling. I can find the tympanic membrane and the malleus, and the tympanic membrane is a pearly gray color. There's no swelling, no erythema noted to that. And again, we'll look at this ear. External ear is good. The cilia are noted. The tympanic membrane is intact. In a pearly color, no erythema, nothing like that. So then we'll move on to assess the hearing. I've noticed that she's answered all my questions appropriately. I haven't had to repeat any of them. So at this time we'll do a whisper test. So I'm going to occlude your ear, and I want you to repeat what I whisper.
Baseball.
And this one?
Basketball.
Great, so she performed that as well. At this time we'll do the Weber test. That's going to test, I'm going to put it right in your head, and I want you to tell me if you can hear it on both sides, okay?
Okay. I can hear it on both sides.
Great, so that's passed. And then we'll do the Rindi test. So I'm going to place it back here. That tests your bone conduction. I want you to tell me when you can no longer hear it, and then I'm going to move it to the front, which tests your air conduction.
Okay. Okay. Okay.
Okay, great. And then we'll do the same thing on this ear.
Okay. Okay.
Okay, great. And so both of those, the bone conduction was about 10 seconds, and the air conduction was about 20 seconds, so that's a normal finding on that. So real quickly, we'll move on to the nose. I'm going to palpate and visualize the sinuses, the maxillary and the frontal sinuses, any tenderness. Great, any tenderness here in your nose. And it's symmetrical, there's no lesions, no malformations noted there. So we'll go ahead and take a look inside her nose. This is uncomfortable, so just let me know, okay? So I'm going to look at the mucosa, which is a pink color, good. I don't notice any excessive drainage. I do see some nasal hairs, which is normal. I'm going to check out the septum. I'm sorry. It's not deviated, no perforations. That's awesome there as well. And then we'll move on to the mouth. How many gloves? Let me grab some gloves. I'm looking at her lips. I see that they're moist, intact. There's no lesions, no cold sores, anything like that. I'm going to look at her gums real quick, and then her teeth. So her gums are pink, no signs of any blood loss or anything like that. She does have braces and one filling on the back. I don't see any dental caries. She has a retainer. Her palate is intact. Stick out your tongue. Tongue is moist. And then, so we'll go ahead and check out her tonsils and her uvula, and then we'll elicit a gag reflex. Okay, tonsils are at a 0. Say ah. Uvula moves. That's great. And then the gag reflex is present. Real quick, we'll check her cranial nerves, especially cranial nerve 12, which is tongue movement. So go ahead and raise your eyebrows up and close them real tight. Great. Puff out your cheeks. Awesome. Can you feel the touching on both sides equal? Okay, stick out your tongue. Great. And move it that way and this way. And push your tongue up against my hand and then here. Great. So that concludes the HEENT assessment. I appreciate your time.